DHEC announcing the state's first pediatric death from the flu. This comes during a spike in respiratory virus cases all across the state.
News 19's Nate Stanley spoke with a pediatric doctor about the new rise in cases and the ways to keep your family safe.
Sometimes they just stop breathing.
Inside MUSC's intensive care unit, there are 8 children with respiratory illnesses, according to pediatric doctor Elizabeth Mack. That includes RSV, the flu, and COVID-19.
They are often struggling to breathe when they come in. They may need more respiratory support than just plain oxygen, and some of them have needed ventilator support.
Mack adds her and her team are working around the clock inside the ICU, giving care to those patients. She says the main reason for these severe cases is unvaccinated children.
Some folks, were hesitant about COVID and now are hesitant about COVID, flu, and other vaccines, which is sad because we know that they do prevent hospitalization, they prevent death.
Alexis Keels is a new mom of a 1-month-old son. She says at first she was hesitant about getting a shot for her kid.
Being a first-time mom, I'm always nervous about, doing things, but then I'm also nervous about not doing it too.
She eventually decided to get him the shot.
I'll get it for him every flu season because kids tend to not know not to, put their hands in their mouth and touch each other and things like that. So.
However, other families prefer to avoid the extra medication. One mom who asked not to be on camera says she doesn't plan to get vaccines for her 2-month-old daughter.
Thinking about it, researching it before we make any quick decisions, just because a doctor told me to do it. Take it decision by decision, and so far we've decided not to vaccinate her.
Mack emphasized the importance for everyone, including the most at-risk populations, to get their shots.
I think there's a lot of room for opportunity for us as a community to really wrap around our children and our adults and go get folks vaccinated.
In Columbia, Nate Stanley, News 19, WLTX.
Well, DHEC says the current flu season started back on October 2nd, and so far, they say there's been nearly 4,300 confirmed cases. Now, we compare that to the same point last year, there have been just 21 flu cases. DHEC is expected to give another update on the state of the flu in South Carolina sometime tomorrow. Meanwhile, DHEC says the shot is available for those 6 months and up. You can get the flu vaccine at most pharmacies and doctor's offices. Insurance typically covers the cost. Free or low-cost flu shots are available at DHEC clinics with an appointment. You can find links to more info on this story by going to our website tonight, WLTX.com.
The CDC says the flu vaccine is especially important for those at higher risk of developing serious flu complications. So who are those folks? Some of those with risk factors include adults 65 and older and kids under 2, people who have asthma, heart disease, or have suffered a stroke, diabetes, chronic kidney disease, sickle cell disease, and obesity with a BMI of 40 or higher. Also at higher risk are pregnant women.